Welcome back to the WHHI-TV Daily News. The Alzheimer's Association has just released their latest facts and figures. And so we're going to talk about what's in that report with Dr. Nicole Purcell. She is a neurologist and a senior director with the Alzheimer's Association. So thank you for being here today.
Thank you for having me.
Absolutely. So let's jump in and talk about the report a little bit. I know one of the things we really want to talk about is why people aren't talking more about Alzheimer's, but let's talk about what the findings in the report say first.
Our Alzheimer's Association Facts and Figures report shows that Alzheimer's disease continues to significantly impact affected individuals, their family members, and our country as a whole. There are more than 6.7 million individuals over the age of 65 living with Alzheimer's disease in our country, and that's a significant number.
Yeah, it really is a significant number. And what are you seeing in South Carolina for us specifically here?
In South Carolina, there's more than 95,000 individuals living with the disease and more than 216,000 friends and family members that are providing that care.
And again, that's a big number. So what do we think is the reason that doctors and patients are sort of hesitant to talk about this early on so we can get it, diagnosed earlier and get treatment going earlier? What's the barrier there?
Individuals report feeling more comfortable discussing their symptoms of memory and cognition with their friends and family so that they can compare notes to see if what they're experiencing is normal for age or abnormal, so they aren't presenting to their primary care physicians with these symptoms. And they're also concerned that they may get a diagnosis of dementia, which is a serious health condition.
Right, they don't want to know, I guess. And so how can we make it part of the conversation? How can we make it more comfortable? How can we take away the stigma of talking about it or maybe the embarrassment or whatever, so that we really are having these conversations? Because obviously it's important to get on it as quickly as we can.
I think it's important to educate individuals that if they're experiencing difficulty with their memory or cognition, or if they have a loved one that's experiencing those symptoms, to bring it to the attention of their primary care physician. I also think it's important for primary care physicians to incorporate this discussion of memory and cognition into routine clinical care visits.
And at what age would you say that you need to start really thinking about having these conversations?
At any age, if someone is experiencing difficulty with memory, they need to discuss it with their primary care physician. If you are 65 and older and you're a Medicare beneficiary, it is incorporated as part of an annual wellness visit, so it should be captured there.
And were there any surprises in this year's report?
I think the most alarming finding of this report is that these discussions are just not happening.
Yeah.
So it is important to reduce the stigma, and as soon as someone notices the symptoms, to talk to their primary care physician about them.
And if somebody is watching today and they want to get more information about the Alzheimer's Association and what you do, and maybe they're just thinking that they might be having some symptoms and want some more information before they talk to their doctor, how can they get more information from you?
They can visit our website at alz.org, and they can find plenty of resources on Alzheimer's disease and dementia, as well as our facts and figures report.
Well, Dr. Purcell, thank you for being here today to help us at least get the conversation going. We appreciate the information.
Thank you for the opportunity to be here.